Hi, I'm Dr. Julie Steinauer. In this segment of Ask Dr. Julie, let's talk about head tilting and why people might do that. Now, if you want to connect with us in your local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either click on filling out a questionnaire, or you can schedule a consultation direct with me. Now, let's go back to talk about head tilting. Sometimes it's known as torticollis when we see a head tilt with an individual, and sometimes we'll notice head tilting associated with problems with hearing or with the ears. So if a child or adult has a hearing problem or ear infection, they may tilt to one side, kind of putting that ear that they hear better with towards things so they hear conversations better. It's also common to see people who have problems with their head, neck, and spine to potentially have a tilt or twist of the head. So it can be turns like this with like the chin pointed one direction. It can be to the side like this. It can also be a combination of maybe like a chin up or a chin down position, and you can get those kind of combined. It's also very common to notice a head tilt for someone who has problems aligning their eyes correctly. Now, this can come after traumatic brain injury, maybe like a stroke. It can come after another traumatic brain injury, like maybe an accident with concussion or whiplash. So you do want to pay careful attention if you have a child maybe who's sitting in front of the TV and they're always in an unusual position to look at it, or they're sitting in an unusual position when they read, tilted and looking down to one side. That's going to give an indication that there's something to do with the way the eyes are lining up and possibly the way the eyes are seeing, that they're kind of getting into this position to make it better. Other individuals who may experience or have a head tilt would be people who have, again, something wrong and going on with their eyes, which is called nystagmus. It's where the eye is constantly kind of wobbling or moving and doesn't stay stationary. In some cases of nystagmus, it's worse than others, where you see more movement of the eye. Some individuals will have an area where they move their head into position and the eye doesn't move that much. And so they may be moving into that head position to control alignment and the movement of the eyes. So you can see there are lots of things that could potentially be, the reason why someone has a head tilt. There are also some serious conditions like a brain tumor. So you never want to just ignore seeing your child or an adult all of a sudden beginning to, develop like a head tilt or twist or turn. You always want to kind of dig in and learn more as to why they might be doing it. Now, a lot of times you can just ask, and someone may tell you, well, I'm doing it because, maybe they're not hearing well. And kids may say, well, I'm doing it because my right eye sees well and my left eye doesn't, or something. So sometimes you can just ask and you'll get an answer, and then you can do something about it. But always pay attention to head tilts, twists, turns, and any kind of unusual head position, as it could mean a lot of things, and it could mean a lot of things for vision. Now, again, if you want to connect with us and you're local, you can call us at 618-288-1489. If you're not local, go to our website. You can fill out either a questionnaire or click a button that says schedule a consultation and schedule a consultation direct with us. If you've not subscribed to our YouTube channel, please do so. We want you to catch all of our videos that we put out on a regular basis. Like this video if you like it, and pass it along if you want to pass it along. You can also check us out on some other platforms. We're now going to be located on Rumble and also on Vimeo. So be looking for videos to be popping up on those platforms and others to come as well. Thank you so much.